name is Christine Joy B. Ayala from grade 12 H1201, and I'm here to present my term paper titled Giving Solutions to Filipinos in Terms of Mental Health Care, the Mental Advocacy of Mental Health PH. The main purpose of my paper is to speak, give awareness, and advocate for mental health in the Philippines. It also aims to give a social program for Filipinos where they can ask for and receive help from an organization, different programs, and even an app. In this way, we can help out many Filipino citizens and we can make changes for our future generations, where everyone is not afraid to speak up anymore, and talking about mental health issues is already normalized. I want many Filipinos to remove their toxic mindset regarding this and allow people to speak up, use their voices, and find comfort within their community, where no one would be afraid to express his or her feelings, emotions, and thoughts. In doing this, we can also prevent suicide, especially among those people who cannot find someone who can be a help in their respective homes, because not everyone has a healthy relationship with their loved ones. There are circumstances that the reason why most Filipinos who are suffering from any mental illnesses and disorders that haven't been treated is because of lack of financial support that will sustain what it needs to get better, and lack of access to some services here in our country. Offering this kind of social program and application for free would be useful in many ways. Not only that, but it can also create safe spaces and a healthy environment for many people, especially those who are dealing with mental health problems. We all know that the situation in our country when we talk about mental illnesses, disorders, or mental health in general is not being given the attention it should need. Most of the time, it is considered a taboo that came from a toxic mindset or culture we had acquired in the past. So, I will take this opportunity to speak about it, teach people how to normalize talking about mental health, and give ways to Filipinos in overcoming this, along with an organization that can be a helping hand for this issue. There are a lot of problems faced by most Filipinos in terms of seeking help. It can be due to the stigma, a lack of finances, and it is not on the priority list. We all know that the life we live here in our country, especially in earning money, is not easy. It takes a lot of hard work and dedication just to earn enough money to provide for our family. I also get the part where every time we have problems, we will immediately turn to our family or friends to seek advice or help. But what if we are facing such mental disorders that need professional help, like depression, anxiety, bipolar, eating disorders, and etc.? It is not enough to just simply talk to anyone, and most of the time, the people around us also have different struggles or baggage they try to carry every day. I discovered this social program in the Philippines called Mental Health PH, which started last 2016. It offers to build a mentally healthier community around the country. It first started as a social media campaign. It aims to share encouraging and inspiring stories to many people that turn into a nationwide movement. There are now 43,000 members in the Philippines. Since we all know that mental health problems are one of the issues we face in our society and has been occurring ever since, building this kind of program helps in becoming aware of one's struggles, mental disorders, illness, as well as fighting the stigma and unlearning toxic beliefs. They also help and empower each member of the said program to support themselves so that they can be able to offer help and support to other people as well. They are also collaborating with various sectors in providing sustainable solutions. Their advocacy is guided by the 3S framework, in which they stay mindful about whom they are creating an impact for. It has been done at 3 levels. Self, which this advocacy gives care and importance to each individual and motivates them to support themselves and those other people if they are willing to do so. Society, this program also cares about the societal level of each person. Regardless if a person is in the lower, middle, or higher class, it doesn't matter. They want to pursue a culture that contributes and bring a positive outcome and surroundings for the good of all people. And lastly, the system. They also care about the people on the system level, and they want to guarantee that the relationship and structures making an impact on our lives are seeking support, rather than the opposite, which is underestimating mental health. While the 3O approach consists of the following: online, They use different social media platforms, networks, live streams, and their website as an online tool for sharing the important resources needed. On ground, they have successfully implemented this by hosting gatherings and facilitating workshops, talks, and seminars for them to connect and be more personal to each person inside the communities. It also allows them to observe the people and meet their own needs. This is specifically for those other people who do not have any internet connection in their areas or who are struggling to have access to technology. And lastly, Onward. They also aim to give an impact onward, so they implement their campaigns, seeking partnership that help them sustainably improve the result. Being able to partner or team up with same-minded peers and organization is another thing that can help this social program to continue serving people in the long run. So the question is, who will benefit from this? The beneficiaries of the social program are anyone, kids, teenagers, and adults, as long as these people can access their website and resources on the internet. And for those other people who don't have an internet connection where they live, it is not a problem as well, because they have a contact number and a crisis hotline who is available for 24/7, where they can easily communicate with and reach out for help. The hashtag Mental Health PH team consists of students in health informatics, public health, medicine, psychiatry, nursing, and broadcast communication. Some of their volunteers also come from various fields here in the country. Another way to reach out for help is through the Lusog-Isip application, which means Healthy Minds in Filipino. It meets individuals where they are and places emotional well-being in their grasp. The application gives admittance to self-improvement and taking care of oneself assets to address emotional well-being and substance misuse needs by welcoming clients to survey their well-being and their coping strategies. It then presents designated assets in subsequent stages to work on that status. The application offers proof-based devices and materials to the users, including workbooks, exercises, audio guides, journaling, mood tracking, and self-care reminders. In giving solutions to the social problems faced by Filipinos concerning mental health, there are many ways we can ask for help, guidance, and assistance like the social program Mental Health PH and the Lusog-Isip application that we can easily download on our devices or browse through the internet. I can assure you that these programs can be a help, and doing this also serve as the first step in overcoming such challenges and struggles. Remember, you don't have to always face everything alone. You're not a burden, and all your feelings and emotions are valid. Someone out there cares and would love to lend an ear.